Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of poisons. 1. Removal of unadsorbed poison. Removal of unabsorbed poison can be done by gastric lavage. In gastric lavage, Eval's and Boas tube is used. Non-collapsible rubber tube of length 1.5 meters and 1 centimeter in diameter is used. One end of the tube contains a glass-like funnel. A mark is made from 50 centimeters to the from 50 centimeters of the tip of other end to indicate that the tube has passed to this extent. Suction pump is placed at the middle of the tube. Procedure. A person is made to lie in the left lateral position or prone position. Wooden gas is placed in the mouth. Gastric lavage too. Wooden gauge is placed. Sorry, a gag is placed in the mouth and gastric lavage tube passed through the is passed into the stomach. 250 ml of warm water is poured into the funnel. Then compress the tube below the funnel and bring the tube below the level of head and release the pressure. Once pressure is released, gastric contents start to come out, or suction pump can also be used to remove the gastric contents. First, gastric washings should be preserved for chemical analysis. The first gastric washings should be preserved for chemical analysis. The gastric lavage continued with water or antidote solution till the gastric contents are colorless or odorless. Same amount of antidote solution or activated charcoal, some amount of antidote solution or activated charcoal is left in the stomach. Solutions used for gastric lavage are 1 is to 5000 potassium permanganate solution, 5% sodium bicarbonate, 4% tannic acid, 1% sodium and potassium iodide, lime water and calcium lactate are used for gastric lavage. Contraindications for gastric lavage. Only absolute contraindication is corrosives, except carbolic acid. Relative contraindications for gastric lavage are volatile poisons like kerosene, esophageal varices, pregnant women, and in coma, gastric lavage should not be done.
thank you and thank you for watching.